This webinar is titled Responding to the Loss of a Student. It is crucial that schools have a plan in place to be able to respond in the most caring and supportive way possible following the death of a student. Response plans are set in place to ensure the safety of all students and staff, maintain stability of school operations, provide consistent information, address emotional needs, request assistance when necessary, and promote a sense of community. 5% of children will lose a parent by the age of 16 years old. Around 40% will experience the death of a peer. A familiar environment, such as a school, may result in a large number of students being able to be served and may benefit from support services not found elsewhere and the ability to be monitored. The death of a student is a traumatic event that affects many individuals in the school community. It is crucial that we have a plan in place to be able to respond in the most caring and supportive way possible. Grief may be presented in a number of forms, including but not limited to anger, confusion, sadness, regression, and emotional numbing. It is the responsibility of the school community to provide a safe, supportive environment in which its members may seek comfort and resources to best cope with their grief. The following slides will focus on creating a plan to respond to such a crisis event in the school. Grief may present itself in a number of different ways for students after the death of a peer. Typical grief patterns may include, but are not limited to, regression. Children may act increasingly childlike and immature. Emotionally numbing. Students may be detached, not crying, and seem rather okay. Acting out. Children may exhibit erratic and explosive emotions, difficulty concentrating, work avoidance, fear, anxiety, and frustration. Repeating questions. Often students have difficulty understanding or accepting death, so they will ask the same questions repeatedly. I'm in the middle. Physical manifestations may include poor appetite, being tired, having a headache or a stomach ache, and thought patterns may include nightmares, fear, or confusion. There are several developmental differences in children regarding comprehension of death. Children have different perceptions of death depending on developmental age. Ages 0 to 3 perceive caregivers as sad but have no concept of death. 3 to 5-year-olds integrate fantasy and false beliefs, do not understand what caused death, and may see death as reversible or temporary. At 5 to 9 years old, they may comprehend permanence of death, concrete understanding of the cause of death, but often cannot comprehend that themselves or loved ones may experience death at some point in time. 9 to 12-year-olds have a complete concept of death, may begin acting out, often in self-injurious behavior. And adolescents ages 12 to 18 fully grasp all meanings and truths regarding death, are at risk for self-injurious behavior and substance use. There are many myths associated with grief in children. 3 myths that will be addressed in this webinar are that grief and mourning of adults surrounding bereaved children has no impact on their grieving process. Adults serve as a model for children in grief, so it is important that they be honest and do not hide emotions. 2. Children benefit from euphemisms such as he went to sleep or passed away. This is false. Children may become fearful of bedtime with these wordings. Children may not understand the permanence of death without using the term dead. Children should attend funerals. Many people believe that children should not attend funerals. Children are unable to confront the reality of death without doing so, and are not given the same supports to grieve in a healthy manner. They also may feel left out, adding to confusion. In order to respond to grief in a school setting, a crisis response team must be in place. It is crucial that your school has a crisis response team and plan in place before a crisis occurs. These individuals should be properly trained and prepared to provide support in the event that your school experiences a crisis. There are several crises that may occur. However, the focus of this webinar will be specifically geared toward responding to the loss of a student due to death. This may be due to cancer or medical issues, drug overdose, suicide, homicide, or drunk driving. There are a number of members and roles, and it is important to create a team that would be most successful in supporting your school community. Suggested roles may include a principal, crisis management team leader, secretary, debriefing lead and school counselors, teachers, and a parent lead. Many counseling tools may be used to aid grieving children. 3 tools to be addressed during this webinar are 1. Create memorials. Lockers or desks may be used as a place for students to write notes, letters, bring flowers, etc. After a time period of providing these materials, they may be given to the families of the deceased. Art therapy has shown to be extremely beneficial with children, as they often are unable to express grief in words. They may express this grief through art, music, or journals. Lastly, group therapy provides students with the opportunity to receive support from peers in a similar situation. Children often avoid talking with parents and will instead turn to peers for support. Studies have shown that post-traumatic stress disorder, depression, and maladaptive grief reactions have decreased due to group counseling. Addressing grief due to death by suicide. Dealing with student death by suicide is especially difficult, and additional precautionary measures should be taken. It is crucial to be aware of contagion, which is the exposure to suicide may increase suicidal behaviors in others. Do not romanticize death in order to decrease the risk of contagion. Speak with parents about what information to share. Also, identify at-risk students. These students may be students who have a personal or family history of mental health problems, past suicide attempts, a boyfriend or girlfriend of the deceased, those currently in mental health or drug treatment, or those not currently in treatment, but many have concerns about this particular student. It is also important to provide education regarding warning signs, encouraging students to seek help, and minimizing media coverage. It is important to note that children will grieve in different ways depending on several factors such as age, gender, culture, disability, etc. Teachers and staff must respond in ways that are most supportive to a child's personal needs, as a one-size-fits-all approach will not be beneficial in this situation. Diversity and age had been discussed in previous slides. The following slides will address 2 specific subgroups of children, those who have autism spectrum disorder and Muslim students. Please note that this is far from an inclusive list. Rather, these 2 subgroups will give insight into how one may tailor crisis response to fit the needs of individual students. Students who have been diagnosed with autism spectrum disorder may grieve in a unique manner. These students struggle with abstract language and concepts, as well as having difficulty connecting with others. Additionally, students with autism spectrum disorder have a need for rigidity and the need for sameness. Loss often disrupts their routine. What can we do to help a student with autism spectrum disorder? Build a team. Consider language. This means to describe the event in concrete terms, avoid abstract statements or metaphors. Don't take reactions personally. Students with autism spectrum disorder may not respond typically. They may laugh or smile when it would be expected that they would cry. Support the understanding and opportunity for expression. Modify the information presented to include multiple formats such as text, photos, music, and technology. Honor routines. Include students in rituals and ceremonies. Prioritize calming and coping skills, and be aware of changing behavior. Diversity among Muslim students. Islam is the fastest growing religion in the United States. It is especially important to develop a plan to address grief needs of Muslim students. Counselors may need training to best serve the growing population of Muslim students. Teachers must be informed of the unique cultural beliefs and practices. A strong faith may decrease symptoms in Muslim children. They may benefit from making a sympathy card to fulfill a good deed. Practice in prayer and reciting the Quran may be beneficial to these students. Group counseling may also be particularly helpful. It is important to contact parents to ask how you may be consistent with religious beliefs and practices. Muslim students may be reluctant to seek help from non-Muslims due to past discrimination. They often have a negative view of mental health counselors. As a result, it would be beneficial to collaborate with Muslim leaders in the community. Overall, working in a school setting presents many obstacles. One of these obstacles may be helping children cope with the grief of a fellow student. There are many ways that we can help these students, such as giving opportunities to tell what happened and how they feel. Encourage them to work with you and make modifications and accommodations when necessary. Don't distort the truth or lie, and encourage questions. Understand that we all grieve differently, and there is no right or wrong way in doing so. Encourage active coping skills and seeking help when necessary. Provide a safe place for students to go, and manage our own grief appropriately. Unfortunately, in the Western New York area, there are not many resources available to grieving children. The present slide provides a list of links that may be beneficial in helping a child who is grieving. The following slides include online resources and professional articles to gain more insight on how to help students deal with grief and loss.